It is 12:01, so we are going to start our Lunch with the League webinar. We are very excited to have you with us today. The Lunch with the League are our monthly webinars where we can talk about a different topic each time and hear from experts who can help our cities with some difficult topics. These are also recorded and will be available on our website so that we can share them with anyone who wasn't able to be with us today. We are particularly excited to have Brandon Hatch, CEO of Davis Behavioral Health, with us today. Brandon with law enforcement in Davis County are trying some innovative programs to deal with individuals who are suffering from substance abuse and mental health issues as they interact with law enforcement, and particularly with misdemeanors. The receiving center that Brandon will talk to us about is an effort between behavioral health, law enforcement, and criminal justice system. We're very excited about that. And before we have John talk more about make the introduction, we're also going to, I just wanted to let you know about our next Lunch with the League. It is going to be on November 15th. We are going to talk about state and broadband opportunities and grants that are coming through. We're going to hear from Rebecca Dilg, who is with the director of the Utah Broadband Center at the Governor's Office of Planning and Budget. We are going to hear from Liz Gavidas, Digital Access and Education Manager for the Utah State Library Division, and Vikram Ravi, with Federal Program Officer with the U.S. Department of Commerce. So talk about grant opportunities in broadband. All right, John, I'm going to turn it over to you.
All right. Hey, thank you. Thank you for being here today. It's great to be here. I think Rachel did a pretty good job of introducing Brandon as the CEO of Davis County Behavioral Health, but I'd like to just take a minute and kind of put this in perspective of where I think we are. As I'm sure you're aware, we've done a lot of work in the last 2 years with our Loveless and Lee Task Force and with public safety in general. And one of the biggest issues that we worry about, and the biggest issues that we've been trying to kind of figure out, is how to help police officers, how to help our first responders when it comes to this interface with not necessarily with criminals, not necessarily with people in accidents and things like that, but when there are real kind of mental health issues for them to deal with. And I don't know, I'm sure you're aware that we don't, our police officers aren't expected to give be mental health experts. However, they're called on time and time again to be able to do that. And so a lot of the things we're working on throughout the state, we're working on a program, the 988 program. We're also working on a program where it's at the state level, where we'll train responders that can actually dispatch a mental health responder with or without a police officer when that type of call comes in. But one of the most innovative, and I think just tremendous program that has been put together in Davis County, who always seems to be kind of at the lead of these kind of issues, is what Brandon's been doing with the Davis County Receiving Center. And how we got to Brandon is he was introduced to me by Tom Ross, who was the former police chief of Bountiful City and now the executive director of CCJJ at the state level. And as we were talking about these type of issues that I just explained, he thought that what Davis County was doing, it was just state of the art. And so I'm just going to turn the time over to Brandon. And one of the things that I think that, well, Brandon, I'll ask you to touch on is that this receiving center is really, as far as I know, the first of its kind in the state. However, it's being replicated in one form or another on everywhere from northern Utah down to St. George. And so with that, I'll just turn the time over to Brandon. Brandon?
Okay, thank you very much. Pleasure to be here. Let me share my screen real quick. I'm guessing you can see that okay. So I think to begin with, let me just say that the receiving center was really a group of people that came together with law enforcement, Davis Behavioral Health, courts, other leaders, county leaders, that came together and said, let's try something a little bit different. So what I'm going to show you today is the crisis system in Utah and how it works, some reasons behind why we started the receiving center, and then tell you what the receiving center is about and what we do there, and then show you at the end some outcomes of what we've had. So we opened our receiving center in December of 2019. So we're coming up on 3 years. We were the first in the state, and really we're the first in the country that's receiving center is a pure diversion. And I'll talk a little bit about that later, but where we put the power into the hands of law enforcement to say to an individual, we can either take you to jail or we can take you to get help without booking you into jail. And so it's a pure diversion, and no one else in the country has been doing that. So let me begin. This is the crisis intervention system in Utah. And you have to think of it as kind of a funnel, right? And right now, this past summer, the 988 number came online for Utah, really throughout the country. But it was a leadership group from Utah that really pushed this in Congress to get this through. So instead of 911, which you would call in a lot of emergencies, 988 is for behavioral health emergencies. And that line is active and useful, and you get certified crisis therapists or instructors there that can deal with those situations. And as you can see on the screen, that they can deal with almost 90% of the people that call just through a phone call, and help them, stabilize their crisis a little bit, and then a referral for treatment later. When that doesn't work, they will notify the mobile crisis outreach teams, and every county in Utah has an MCOT team, and they're able to deploy out to an individual's home and help deal with the situation there. In many cases, when they feel like that individual is safer to be out of the home or be somewhere where they can get some immediate attention, they'll refer them to our receiving center. And our receiving center is in Farmington, and center of the county almost. And we're able to stabilize about 90% of those that come in to our location. And we'll talk a little bit about the patients and what they look like in a bit. If we're not able to stabilize them there, they're sent to either a residential stay, some kind of hospitalization, and if that can't be stabilized, then more of an acute inpatient bed stay. So you can see we serve a lot of people through the crisis line and MCOT, and then fewer people, which is what we want, to have fewer people down in the hospitalization area. So those with mental health are 50% more likely to be arrested than the general population. And, it's one of the goals that we have to try to address that. John was right in his remarks at the beginning. Law enforcement is being asked to deal with more and more of this, and it's becoming more of a problem for them. And we'll talk a little bit more about that as well. But, those with mental illness, often, people characterize them as being shooters, or those that have, are predators, and they're more likely to be victims in those situations. But there are a lot of arrests, and our crisis team is supervised by Dr. Todd Suter, who spends a lot of time throughout the state, not only Davis County, but throughout the state, training officers on how to deal with crisis and mental health situations. But officers, when I look at this funnel here, in here, you don't see law enforcement anywhere. You see mobile crisis in there, but law enforcement doesn't really have, you know, a good place, a good system to send people to. And the receiving center is now that option where they can refer and bring people there. In the United States, 44 of the states across the country have more people in jail that have mental illness than in those psychiatric hospitals in each of the states. So that tells us that we're arresting a lot of people with mental illness and we're putting them in jail where they're probably getting limited treatment, if any treatment. Across the country, if someone is taken to, whether a family member takes them to an emergency room or a law enforcement, the standard, the average time for that person to wait in an emergency department before they're treated. And remember that emergency departments are really geared for physical health. And so when you take someone in there, they might be in there while the hospital tries to find them a psychiatric bed, either in their hospital or somebody else's. So imagine you take a family member in, or law enforcement does, to an emergency department. They're sitting in there waiting. They're racking up a pretty hefty hospital charge, right? And then they're going to be transferred by ambulance in a lot of cases to a hospital that does have a psychiatric bed. So now they've incurred the cost of an ambulance ride, and then they're going to be charged for some time in a psychiatric bed in a hospital. So the standard, the average is about 7 hours across the country. The survey a national survey of law enforcement agents by the Treatment Advocacy Center found that 21% of all total law enforcement staff time was used to respond and transport individuals with mental illness. And I think, if we have individuals on the call from rural Utah, you can imagine what that would be like for law enforcement to have to travel a fair amount of distance to either transport or respond to someone with mental illness or substance use issues. So it's one of the goals of the receiving center to give law enforcement a tool, right? A place they can take someone to address mental health, substance use, and be able to, not have to spend a lot of time in an emergency room. Emergency room visits are about $2,200. Not necessarily affordable, right, for everybody that goes in. So if you have a family member with an adult child at home who struggles with mental health and their symptoms become unmanageable and they take them to an emergency room, they're probably not going to get a whole lot of help on their behavioral health issues there until they can transfer them to a bed somewhere. So the costs of, emergency departments, law enforcement would tell you they spend a lot of time in an emergency department, filling out paperwork, getting that person checked in. The same thing applies when they take them to jail. A number of officers have said, I can take someone to an emergency department and I'll be there filling out paperwork when I see that individual walk out the door. And so they spend time longer, in an emergency department in some cases than the patient does. So let's talk a little bit about the problems that we looked at that we really wanted to address. There's an over-reliance on law enforcement for mental health and substance use issues. John said that at the beginning. Excessive wait times in emergency room for both patients and law enforcement. It's faster to incarcerate someone than take them to the ED. And so going back to the slide, where 44 states have more mental health people incarcerated than they have in their state psychiatric hospitals. It's just a little bit easier, and that's not necessarily the reason why law enforcement takes them there. There's usually some kind of a crime involved. Jails are relied on in Utah and other states to hold, medicate, that should say medicate, not Medicaid, to medicate, to treat nonviolent mental health offenders and substance use disorders. And there's a lack of discharge planning from both hospitals and jails when it comes to individuals, and they might get some help and send out the door, but they have pretty complex needs that need ongoing treatment. So we, in the summer of 2019, we gathered a group of people, people from our own office, some therapists, some of our leaders. We had the Davis County Sheriff join us. We had 2 police chiefs from 2 law enforcement agencies. We wanted to start small with 2 cities when we opened our receiving center, so we could work out some of the bugs that we might have, and then we would open it up to all agencies. So we started with 2 police chiefs. We brought in city prosecutors from those cities. We really thought, as we addressed, or individuals were picked up for theft, in relation to a drug crime, or they had warrants, or they were trespassing, those kind of things that a city prosecutor might deal with. We wanted to make sure they were on board and work through some of the details about how we would make that work, when it comes to really diverting away charges if someone was willing to get help. So we brought city prosecutor, we brought our county attorney, Troy Rawlings, to the table. We had a district court judge. We had someone from the defense attorney's office. We had county commissioner participate. We wanted to try to work through all the bugs to get it worked out so that we could get things up and going. Our biggest challenge after we kind of had our plan and what we wanted to do was location. Where would we put this? We wanted it to be central in the county, and we're grateful to our fantastic county sheriff, Kelly Sparks, who stepped up and said, you know what, we have a building. We will clear it out for you. You can use it. We can give it to you for a year or a year and a half. And that gave us time to remodel a different building. So we were ready to open. So let me spend just a minute to talk about what the receiving center is. So it's a no refusal drop-off center, not only for law enforcement, but also for our mobile crisis outreach team, that goes into the community and does those crisis outreaches. We wanted it to be available for family members who have adult children. This was for adults only. Had adult family members who needed help, and they were tired of calling the police to help intervene, or they were tired of taking them to the emergency department. We wanted them to have a safe place to come. It's for self-referrals as well. The no refusal piece means that if law enforcement brings us someone, we take them. No questions asked. We have worked with law enforcement to say, if it's a DUI, they're not appropriate for us. If it's a person-on-person crime, not necessarily the right place for them. But if it's someone who has a misdemeanor, and we'll talk a little bit about this later, but around substance use, or if they're acting out on their mental health symptoms, if they're suicidal, we're the right place. As long as they can walk in under their own power, we'll take them. And it functions as I mentioned previously, as a pre-booking jail diversion, meaning when an officer, picks up someone that has, public intoxication, or maybe they're in possession of an illegal substance, they will say to the individual, listen, I can take you to jail, or if you're willing to get help, I'll take you to get help. And as long as they do, and some people still choose to go to jail, they're not ready to get help yet. But as long as they are willing to do that, volunteer to come in, they'll bring them straight to us. We deal with a lot of different kinds of things there. You know, a whole gamut of mental health and substance use disorders that we see there. We see people come in that are not Davis County residents, but have maybe been picked up by law enforcement. They live in a different county, a surrounding county. We've had some people from Wyoming and other states who have been picked up in Davis County and brought to the receiving center, and we try to help them get help and or referral back to their own community. The first thing that happens when they come in, we gather a little information, we do an assessment, and then we put them in a recliner for 24 hours generally. In that recliner, they'll detox from whatever substance they're on. We'll assess them for suicide. We have 24/7 medical on staff, so we do a medical assessment right when they come in the door. We do another one when they leave. We work on, we do medication assisted treatment to help them, those with heroin or alcohol use, to help use medication to help them detox and prepare them for treatment. And then we have peers there as well, and I'll talk a little bit more about them later. So that's what it is. It really is just a drop-off center where people will come in, drop off a family member, drop off someone they picked up in their, you know, that law enforcement has picked up. Our MCOP team will bring them in, and they'll bring them to us, and we keep them there. So what do we do when someone gets there? We do a medical assessment, a nursing assessment at intake to assess for medical stability. We do an evaluation. We have a therapist on staff 24/7 to assess for risk or suicide risk, and to make recommendations to the rest of our team. What should happen to this individual? What should their treatment level of care be when they're discharged? Or mostly, what do we need to do to help them now? We have a peer on staff, someone that has that similar experience, right? That lived experience to help them connect. They're so good about being able to go to an individual that has come in intoxicated and say, I've been where you are, and let me tell you how we can help you. Our peers, they engage with them, and then they stay engaged with that individual for the next 4 months. We ask them to do constant outreach to make sure that we get them in treatment, eliminate any barriers. They might have transportation or childcare problems. We're trying to find ways to remove all the barriers to treatment so that they have that opportunity. And the peers are fantastic about doing that. They might need, we have case management there that they might need to, you know, help with, you know, signing up for health insurance, or they might need the help looking for a job. One of the things that we do with those that law enforcement bring to us that have warrants out, we help them resolve those warrants. Generally, someone stays at the receiving center for a day until the crisis is resolved, but sometimes when they're in detox or the mental health crisis is a little bit more severe, it takes us longer. And they might be there for 3 days, 5 days, 7 days. We'll hold some people there until a bed is available at a treatment facility or residential treatment facility. We don't want them to have a setback between seeing us and going there, so we'll hold on to them a little bit longer. And we'll start the induction process for opioid treatment. We provide medication-assisted treatment through that, which provides some opiate blockers. And we want to remove every barrier that we can. And so every service that they receive at the receiving center is free. We do bill insurances, but there is no charge to the individual. Who do we get referrals from? Local law enforcement. We have every department in Davis County is making referrals, bringing people in. Adult probation and parole also brings us a fair number of referrals as well. And these tend to be people who are on probation. They come in, they fail a drug test, and rather than send them to jail because they failed the drug test where they're not going to get any help, they will bring them to us and we will try to help re-engage them in treatment. Our crisis team, when they go out in the community and meet with people, as I mentioned before, if they aren't safe in their community, then we're going to bring them into the receiving center and give them an opportunity to resolve the crisis and then focus on treatment. Our community partners will refer to us. Hospitals will often call us and say they're sending someone down to us, usually someone who needs to detox off of something, or someone with mental illness that they think we're a better fit for. Family and friends, and you'll see in some of our outcome data that family and friends and self-referrals are some of our biggest referrers. The self-referral has really grown. It's individuals who feel like they are unsafe, unstable, suicidal. They need a safe place where somebody can watch them and keep them safe. We have individuals who have relapsed and they want to start over, so they're coming in. And we have people that are in recovery, substance recovery, who will walk in and just say, I really feel like I'm about to relapse and I need some help and I need somebody to watch me. And so we give them a safe place and a safe bed to be in. Target population 18 and over, mentally ill, showing signs of mental illness, including thoughts of suicide and self-harm, substance use, active use, intoxication, seeking substances, seeking help. Those are in there. Misdemeanor crimes, as was mentioned, that have a drug nexus. Someone's intoxicated, have paraphernalia, they have possession of substances, or they've shoplifted in order to support their habit, or other drug or mental related, health related offenses as well. Warrants, we really thought we would see a lot of people picked up on warrants for their arrest, but we don't see as many as we thought we would. But when they do come in, we help them address it. The purpose, what did we hope to do? We wanted to decrease the referrals to jail by law enforcement. We wanted to decrease the rate of arrests after 6 months, so check with them again after 6 months. Have they been rearrested? Increase in use of the receiving center by our partners in emergency rooms, engagement and treatment by people who are there. And one of the other big things we wanted to do was make it fast for law enforcement so they could drop somebody off and get back on the street. We wanted to make it super fast for them and easy, so they just had to walk them in the door and say, here they are, and they're done. So let me talk about outcomes for a few minutes, and then I'll happy to take some questions. Last year we had 988 admissions. These are unique individuals, meaning these are all one-time admissions. We did have more of people that have come in and then self-refer, again later. We have very few that are brought back by law enforcement. So when law enforcement picks them up once and brings them in and they start engaging in treatment, it's not very often that law enforcement will end up picking up that same individual. So we're having some success there. So of those 988 one-time admissions, let me show you some of our outcomes. First of all, where are they coming from? And when we first opened in 2019, this whole pie was filled with just law enforcement. This doesn't mean that we've seen fewer law enforcement referrals. We actually see more and more all the time, but the rest of the pie is just growing. And you can see how often self-referral is happening. Family and friends is So we're coming up on 3 years being open. And as more people become familiar with us and where we are and what we're doing, we're seeing a lot more family and individuals referring themselves in, saying, I'm ready for help, I need it, I want to start here. And so we bring them in. So you can see, you know, in our own crisis team brings in quite a few people as well. But 3 out of the 4 are brought in by, well, not quite 3 out of 4, maybe 2/3 of them are not law enforcement, which has changed a lot, but we still get a lot of law enforcement referrals. When someone comes in, we ask law enforcement, we have them fill out a very brief survey. And one of the questions is, you know, what are you bringing them here for? And you can see that outside of, while that mental health and suicide piece of the pie grows a little bit every quarter, the rest of them are all substance use. Probation violations, possession, all of those are substance use. So we get a lot of that. We ask law enforcement, what would you have done with this individual had the receiving center not been here? And as you look at this pie, you know, we're doing what our goals were, right? We're diverting from jail in a lot of cases. We're diverting from hospital stays and the cost of the hospital stay. And when I look at this pie, what I see is, in all of these situations, an individual is not likely to get help for their behavioral health. Whether they're in jail or whether they've gone to an emergency room, stayed at home, they're not getting help. Or they're getting minimal help. They'll get a little bit of help at the jail, and if they end up in a psychiatric bed in a hospital, they're going to get some help there as well. But most of these people, you know, that are coming to the receiving center would never have gotten treatment or linked with treatment had it not been for the receiving center being there. As I mentioned, this is one of our goals, right? Get law enforcement out there. So we ask them when they come in, how long did it take you? Tell us how long this process is taking you to bring someone here. And our average is around 3 minutes, but 5 minutes or less for almost 80% of law enforcement that are coming in. And that's fantastic news. We're putting them back on the street. We also ask law enforcement, what is your satisfaction? Do you like having this here? And you can see that the vast majority of law enforcement bringing them in are saying, this is great. This is exactly what I want to do. I'm helping people get help. Now let's spend a minute on this one. One of the things that we do is when someone is brought in by law enforcement because they have committed some kind of crime, right, or would have been in jail, we give that individual 60 days to engage in treatment with us. They may only be in the receiving center for 24 hours, but we do a tremendous amount of outreach in the first 60 days. If they're not showing up for treatment, we're on it. We're working hard to get them in. If for some reason we are not able to engage them in treatment, we call the officer back and say, here's the case number of the individual you brought in. They've not engaged in treatment. And then the officer has the choice to go back out and pick them up, arrest them, take them to jail if they want. Or they can go back, pick them up, bring them back to us if they choose. You can see with those with substance use issues when they come in, whether it's possession, warrants, paraphernalia, intoxication, we are able to engage 57% of those in active treatment, meaning they show up at their appointment that they have scheduled and they've engaged in treatment. Now, remember, going back to one of the previous slides, if the receiving center hadn't been there, that 57% would still be using substances most likely. So we're getting better at this, at the engagement piece, and we're seeing that change a little bit. But it's good engagement. On the mental health side, those that are coming in are saying, yes, I need help. And 82% of them are engaging in treatment. I think I'm just about to the end of 40 minutes or so. And there might be some questions. So John, if I can just turn it back to you for any questions.
Yeah, great, Brandon. And so we talked a little bit before we invited everybody in about, well, let me just preface this. We know that Governor Cox has made these type of programs an important aspect or important prioritized it for his administration. And I know that we are growing this concept. Would you kind of go over where you see, you know, what this is being replicated across the state? Would you tell us a little bit about that, I guess?
Sure. Yeah, absolutely. It's one of the things that we wanted to do when we created our own. If it was successful, we wanted to make sure it was replicated elsewhere in the state so everybody could have this opportunity. So with that, we showed some early success, and the legislature started appropriating funding to build and operate receiving centers. So currently there's a receiving center active, open and active in Utah County. There is one in Washington County that's coming on board, I think, anytime now. They were building a building, and I think that's done, and they'll be opening if they haven't already. Salt Lake County is ready to break ground on theirs, and Salt Lake County's is going to be big. It's a big building that not only has a receiving center in it, but psychiatric beds as well on a different floor. Weber County has partnered with McCady Hospital for a receiving center there. The city of Price is going to have one open. I think they open next week. They have one opening there, and Cache County is working on one. We're trying to get these into some of the rural areas. We're not sure exactly how to make them work, but we know we need to try something. The governor did come out to our receiving center, I think in August, took a tour. We sat down and had, conversations about what's working and what's not. And he has made it a priority in his upcoming budget.
Great. And so, I mean, that's good to hear. One of the questions that came up was how is this replicable in rural Utah, and you're talking about Price being able to do that.
Mm-hmm.
And I imagine that we can not only do this on a county basis, but through maybe cooperative association of governments,
Yes.
kind of situation.
Yeah, and I think that there are a couple of ways to make it work in rural Utah, right? You have a hub that might be Price, and then you have law enforcement out in some of these other communities that might be far away, and they may or may not be all that interested, right, in transporting someone a fair distance to a receiving center. So we've talked about the possibility of some of those rural centers being able to do the transportation themselves. They'd go out to maybe a law enforcement office in a different community and pick that individual up and bring them back to the receiving center. There's talk of in South Dakota, they have a similar process, and they're pretty rural, and so they've had more of a telehealth kind of a process where jails or law enforcement agencies have rooms where they bring people to, and they have a recliner in the room, and everything's done by a video assessment, and so they're having some pretty good success doing it that way, and it's something that we could probably look at as well. We won't really know until we try it, I think.
Yeah, it's interesting, and I mean, I love what we're doing with MCOT teams and things like that, but a lot of the public safety officers I've talked to in Davis County and other places, the thing they loved, and you mentioned this, the thing they love about this program is that it literally, you go on a call and there's a mental health issue associated with that call, that you can pick the person up, take them to the Davis County Receiving Center, and literally be done in 15 minutes. I mean, you talked about 4 minutes, but I'm talking about transport and everything else. They can literally be done in 15 minutes. And how much they love the fact that they have a solution, and two, they know that solution is as effective, if not more effective, than actually putting these folks in jail. So,
Yep.
So appreciate that. If anybody else has any questions, please put it in the chat room. I got some Q&As here. Let me kind of read through that. One of the questions from Holly was, thanks, Holly. 2 questions. Where's the receiving center located? And I think you mentioned it's in, well, you said you originally opened in Farmington. Are you still there?
We still are. So we're in Farmington, and the plan is to we're actually right on what is it, 200 West now. So we stayed at the jail's building, the county's building, for about a year, and then we've moved into a building that we own in Farmington. It's just past well, I don't know how you want to say it, on 200 West, just before you get on the freeway in Farmington. And it is it's central. We are actually in the process, and sometime in the next 30 days, we'll be opening a second receiving center in Layton at our campus over by Davis Hospital, right in Davis Hospital's back parking lot.
Right.
And so not necessarily, it's going to be a good receiving center. We want to make sure that we're closer to everybody, all of our law enforcement partners. I see that Holly has a follow-up question on that as well. Yes, people can walk out anytime. It's a voluntary program. In fact, we do have had a handful where law enforcement has brought somebody in. They've agreed to come in. As soon as law enforcement pulls away, they walk out the door. In those circumstances, we call law enforcement immediately and say they've walked out the door, just letting you know. But usually if somebody comes in, it's very rare that they just leave on their own. We spend a fair amount of time having a discharge, setting up a discharge plan, setting up an appointment. Okay, you're next Tuesday, you're going to come in, and this is who you're going to meet with, and this is where you're going to go. So, but it is a completely voluntary program.
Great. And then Jennifer, do you know when the one is in Washington County is opening?
I've heard that they will open this month, the month of November. They certainly said that they would be open before the year is out, but they are opening soon.
Okay. Great.
One question I had is, do you have any advice for any cities or counties that are looking to replicate what you're doing? Are there things you would do differently, or what are some access to opportunities? What advice do you have?
We made some mistakes initially when, we started talking about a receiving center 4 or 5 years ago. And our first approach was well, we need funding to make this happen. So we're going to go find some funding. That wasn't the smartest approach. That wasn't the best approach. The best thing that we did after we were turned down on some funding is we gathered the group together that I went through that list, and we started planning out exactly how this was going to work. And it was the smartest thing that we had ever done. And, we have encouraged our partners, across the state, other behavioral health centers to, build relationships with law enforcement. We can help them and they can help us. And if you're, someone that works in law enforcement, get to know your behavioral health team and find out what they can do for you. I mean, even the mobile crisis outreach that we do could be worked with law enforcement, and really take some of the pressure off of law enforcement on having to make decisions around mental health. And but bringing that team together was the smartest thing we did. And if I were to do it over again and encourage anybody else to build a receiving center, I would start with a team of partners to make this work. And then the funding piece came later. We felt it was important enough that we put some of our own money forward to build it. We knew if we could open it up, we would have success in it, and then we could show that success and then try to get funding partners to join, because we could show the success of it. But there is, a lot of interest in the legislature. Counties have a lot of interest in having these opened in their areas. And as mentioned, the governor certainly has an interest in plans to put a budget toward them.
Okay, great. And Jennifer also asked, is there a specific behavioral health organization that's in creating this? And you are the county health department, correct? And that's where that came from.
We're actually a nonprofit, but we're part of the local mental health authority system. So there are 13 county behavioral health systems in the state. We just happen to be it for Davis County. But for example, one of the local authority regions is Cache, Box Elder, and Rich County all work together with one local mental health authority. So those county behavioral health authorities are the ones that are really pushing and working on receiving centers. Central Utah has, one for like 5 counties around them. Washington County, Southwest Behavioral Health down there is the county provider for 5 counties in that Southwest region. So it really is the county behavioral health system that is working on these and putting them together. There are, I should mention, Intermountain Healthcare has been developing access centers. They're a little bit different, but LDS Hospital, McCady Hospital, actually the University of Utah has one where anyone that comes into, that's a walk-in, not necessarily a police drop-off, but a walk-in for mental health reasons, and they walk into an emergency room, they will move them in the hospital to a different room that's geared for mental health emergency crisis treatment. And so, and they call them access centers. And there's just like I said, a handful of those, but receiving centers are a little more robust in treating all different kinds of behavioral health and accepting law enforcement drop-offs.
Great. Thank you so much, Brandon, for your time. I just feel like that this is not just important for the people that you see, but I think this is a great big step in the mental health of our first responders, in that a lot of the stress that they're feeling, a lot of the problems that are associated with their mental health aspect comes from trying to deal with these kind of situations that they really don't have the training, they don't have the resources, and they're not really able to have solutions. And that's a hard thing. And I think that what you've created here is going to be a huge step toward that. And so I want to thank you for your efforts. I want to thank you for your creativity and the ability to think outside the box. And it's not very often that us in local government feel comfortable experimenting, and you've done that, and to a great success. So thank you for your time, and thank you all for your attendance today. Rachel, I'll turn the time back to you.
Well, thank you again, Brandon. This is amazing. This is really interesting, and we appreciate what you're providing to public safety and advancing mental health in our state. So thank you for being here. This webinar will be available on our website starting tomorrow, and we encourage everyone who is here to share it with their colleagues. We'll have another lunch with the league on November 15th at 12 o'clock, where we're going to talk about opportunities in broadband across the state. So we hope to see you then. Thanks again, everyone, for being here. Appreciate it.
Okay, thank you. And thank you again, Brandon.
Thank you.